All right, what's up guys? I am here with Dr.Yani in Fort Lauderdale, and I just had my teeth cleaned and it was amazing.
Awesome.
My dad too. My dad has Parkinson's, as some of you guys know, and he had a mouth that was filled with mercury. Mercury fillings, often called silver fillings. Dr. Yani is going to explain why that's not as awesome as we may have been led to believe. And just like a couple fun facts, half of all silver fillings are made up of mercury. And mercury is the most volatile and toxic of all heavy metals. And what Dr. Yani does at her holistic dental practice in Fort Lauderdale is she'll look at what are some of the sources of toxicity in your mouth, whether they're infections or related to mercury and fillings or past work that you've had done, and she fixes it so that you're not dealing with the risk of cancer or fatigue or autoimmune issues that affect us. So what we're going to do in this video is Dr. Yani and I are going to hang out and share some cool stuff with you guys that you may or may not be aware of, and you're going to get the chance to ask her some of your most pressing questions. Whether or not you have mercury in your mouth, if you have someone in your life that you love, you'll be able to ask Dr. Yani and she can help you out because she's a wealth of knowledge, and this is an area where I default to her. So Dr. Yani,
Thank you. Good to have you here in the office. Thank you for a biohazards guide. Love the book. I mean, just from screening briefly, I noticed that we share a lot in common in regards to wellness, because our main goal is, help and heal overall our body. And a lot of people are completely unaware that everything and part of the healing starts in the mouth. From gum disease and like you discussed, the toxic mercury silver fillings, which their content varies from 50 to 55%, it's mercury. So why don't we call them mercury fillings? Well, that's what we're here to explain and make you aware of. Our goal is to create an environment in your body where your own body can heal by itself. If we remove the offending factor, then your immune system will improve, will eliminate toxins, and also that will create a more lymphatic drainage. Cell regeneration will be much normal. And also love to get my patients in the concept of the microbiome. We'll hear about leaky gut and the problems in our intestine and the absorption, or malnutrition because of all these fast food, stress that's causing it, all the adrenal fatigue. But we gotta make a stop and treat what is simple and evident. A lot of physicians don't even look into people's mouth, and they don't make the correlation of gum disease with cardiovascular problems, diabetes, arthritis, and numerous autoimmune conditions. So we're here just to create that curiosity in you, explain a couple of issues that's going on, and be available with broadening up a little bit your knowledge and thinking beyond the box that we're taught to think,
Yeah, for sure.
So,
one of the ways that this was brought to my attention is I've worked with a number of oncology doctors in the cancer space, and one of them told me that 50% of the people that he deals with that are suffering from cancer often have dental problems, whether it's infections or they have mercury that needs to be removed. For people that may be watching and are like, mercury, if this was actually bad for us, why would they be putting it in our mouths? Give us a little bit of an idea of what mercury does inside the body. So we know mercury it's classified as a toxin before they put it in our mouths.
Right.
And when you guys remove mercury from people's mouths, it has to be picked up by the EPA, the Environmental Protection Agency.
Yeah.
So it's a toxin when it's removed from your mouth, but it's not a toxin when it's in your mouth, which is kind of interesting. What happens when someone has mercury in their mouth and that vapor is released when they chew or drink hot liquids? What happens in the body?
Okay. Once you have mercury in your teeth, you're going to have mercury in every single cell in your body. Now, a lot of people are healthy and they don't develop chronic inflammatory conditions because they're good secretors. They're able to eliminate all the toxins out of their system. Unfortunately, any heavy metal like mercury, cadmium, lead, they have cumulative effects over time. So, I don't know anybody getting any younger, but as we age, our system and detox protocols within our cell are not as efficient. So we start settling to believe that a lot of conditions going on in our body are related with aging. and not related with the toxicity that we might be carrying in our body. Now, mercury will cross placental barrier, and that'll be the first exposure to fetus. Will cross cell membrane barriers, brain membrane barriers, so it has a preference over brain cells. It's considered a neurotoxin affecting cell and brain regeneration. That's what it's linked with Alzheimer's, Parkinson, Lou Gehrig's disease, and several autoimmune conditions as well. So we try to educate patients to create that awareness, because a lot of people are of the belief, oh, if it ain't broken, don't fix it. But when you get to a more advanced age, a lot of things will need to be fixed, and a lot of things will have that cumulative effect of sometimes not being able to be reversed. Also, there's a connection with high blood pressure, because mercury inhibits certain enzymes regulating blood pressure, and this is the first thing that I see on patients where blood pressure is not very well regulated. I make them aware of considering removing the mercury fillings as part of creating a better environment in their cells. I mean, there's a study, I don't know if you're aware, this study was very famous and was the landmark why mercury fillings are so toxic. Sheep was implanted with 10 fillings.
Sheep?
Yep, sheep.
Okay.
Thank you for correcting the language. 30 days later, she was pregnant. 30 days later, they noticed that the distribution of the mercury that was put in her mouth was seen in the brain, in the stomach, in the kidneys, and also in the pancreas. They noticed the fetus was also toxic. They were able to trace mercury in the fetus. And so this is one of the main studies that shows the toxicity level of mercury fillings.
That's huge. Yeah, that's a huge point. And I've actually heard that people who have 8 fillings have roughly twice the levels of toxic heavy metals, mostly mercury, in their tissue compared to other people.
Yeah, and the preference also goes on the kidneys. Kidneys regulate blood pressure.
Yeah.
So I just want to make patients aware of that, because a lot of people won't even find the answer of other conditions on what's in their mouth. Now, another effect that we have every time you're going to eat or chew, produce heat. Mercury is a liquid metal in room temperature. If you elevate that temperature with any source of heat or friction, there's going to be production of toxic vapors.
Which is happening all the time. If you're chewing or drinking coffee, tea,
all the time, and they will dissipate through your lungs into the bloodstream. And then you have the preference with the connection with brain cells and the kidney primarily. So this is something that needs to be seriously taken under consideration, because we're treating nowadays the problem with high blood pressure, but we're not targeting where is the cause, where is this toxicity, where is the problem originating. A lot of people are settled to believe, oh, it's genetic, my family had high blood pressure. I mean, I come from a family where we tend to believe, oh, it's genetic high blood pressure. I don't have high blood pressure.
Yeah.
I don't have mercury fillings now. I had them, and I was a victim of the effect of mercury, not only from the toxicity. I would say that it had in my endocrine system, but the level of infertility. I was not able to develop my uterus normally, and I didn't make this connection until mercury were removed when I was in dental school, and then my body started acting normally. Hormonal levels were normalized. Thyroid, I had thyroid issues my entire life, not knowing that mercury was one of the offending factors too. So there's so much connection, because the effect of mercury affects so many different systems.
Yeah.
We see also the transport of oxygen. Mercury will connect with the receptors of hemoglobin. So hemoglobin are these components that carry oxygen within the cell. That's why one of the side effects of people that have chronic mercury exposure and toxicity is fatigue. They're very tired. They don't have energy. and they're trying to look what's causing. Is that my diabetes? It's heart problem, but they have highly toxic mouth where their immune system is constantly triggered to attack. The other problem that we see is mercury connected to a white blood cell will create a ghost cell where your immune system start acting in a very irregular way.
Like it starts attacking itself?
Yeah, and that's the whole purpose of the whole cause of autoimmune condition, because your own body starts attacking your own tissue.
Yeah.
So mercury acts in so many different levels, so many different systems, that's why the diagnosis of mercury toxicity can be also very complex.
Yeah.
I mean, we usually...
It almost sounds like, I had Lyme disease years ago, and like it's known as like the great imitator, because there's like 200 symptoms of Lyme disease that mimic other diseases.
Right.
And it sounds like mercury is similar if you're dealing with hormonal issues, fatigue, fertility problems. Really, it could be almost anything from what you're saying. Give us a little bit of an idea before we show them some pictures of what was going on in my dad's mouth, because like I've been asking my dad to have his removed for years, and my parents were kind of ho-humming about it, and then my dad came down to visit me, and I found Dr.Yani in her practice and brought him in, and they've now, as of today, removed 100% of the mercury that was in my dad's mouth. Hopefully,
yeah, today he's mercury free.
My dad is now mercury free.
2 long appointments.
He's out there drinking soup in the lobby, celebrating. I'm sure he's like, that's okay. But a lot of times we're so focused on detoxification, where we're using infrared saunas and juice fasts and some of these things that people are becoming more aware of, but they don't eat, they're unaware of the source in their mouth. What's the difference?
I still encourage though.
Yeah. Of course.
Until you make the commitment to get your mercury fillings removed out of your mouth, I'm totally pro detox. Of course,
Still detox.
It's not going to be as efficient because you still have the main source of mercury in your body leaching out of your teeth every day, every hour. But the fact that some people take a little while.
Watching her like,
yeah, I mean, it's a commitment, you know, because I've seen mouth with major reconstruction made with a mercury filling, and not everybody is completely committed to get a whole mouth reconstruction at once. So I encourage patients, if they can get in some type of antioxidant supplements,
like alpha-lipoic acid?
From selenium, N-acetylcysteine, alpha-lipoic acid, reduced glutathione, maybe a liposomal version for better absorption, because glutathione is very difficult to be absorbed just orally.
You had my dad doing some activated charcoal as
we
well.
We do that always after we remove mercury, and then we give a set of antioxidants.
Yeah.
But I don't know if I should talk about the cilantro, because I saw something cilantro and something that Trump said.
Cilantro can help.
But cilantro is a natural herb that helps detox heavy metals as well. So I do encourage my patients to do any type of modality that I can do. The infrared, because it improves blood supply, lymphatic system drainage.
Rebounding, jumping on a mini trampoline to get her like a vibration plate, that can also be great.
Yeah, I'm reading about that in your book. That was quite interesting. You see, there's something new to learn.
It's fun too. All right, so we're going to show them some pictures of my dad, but before we do, what, for someone watching that's unaware of the differences between a traditional dentist and a biological dentist or a holistic dentist, what are some of the differentiating things? You don't work with mercury, you don't work with fluoride.
No.
What else?
Well, the products that we put in our patients' mouth are trying to pick the most biological products from porcelain. Porcelain, there's going to be different type of porcelain. Some common ones also are made of aluminum oxide. We don't work with aluminum. Aluminum increases also the neurotoxicity and the toxic effect in brain cells. So we avoid BPAs, because BPAs is linked also with infertility and sperm reduction.
BPAs are a lot of the chemicals
in plastic. But why composite? Are made of plastic. And you'll be surprised, because my sister and I, before we made the commitment to be a biological dentist, we have to go through so many materials and discard all of them because dentists provide a lot of toxicity, and we're not trained on the chemistry level of what we offer the patient. We're more trained on what's durable. Mercury is durable. Yeah, mercury fillings can last there 20, 30 years, but at what cost? It's costing you your brain cells.
Yeah, just look at my dad. Maybe that was a part of it.
Lead to degenerative diseases of the central nervous system.
Yeah.
Also, get transferred into your newborn, the first exposure to heavy metals. We're enough exposed by environmental toxins. We don't want to put more burden in our body carrying toxic metals that will be affecting our endocrine system, our thyroid system, our kidneys, our brain cells. So it's just creating that awareness. This is not something it's made up, it's science. Biologic dentistry is based on science. I'm a member of the International Academy of Oral Medicine and Toxicology. It's a group of very advocated professionals that do research about the toxicity of materials and the biologic effect that it has on the cell membrane, on the mitochondria, and how to avoid these toxins and materials to not be even taken under consideration as a feasible restorative option in our patient's mouth. So, I mean, this is what brought me passion. I've been practicing dentistry for 20 years, the last 10 years, gearing more to a wellness, a way that how can we get better results on our patient.
Yeah.
If we put toxic materials, we're gonna get allergic reaction. We're gonna get toxic reactions in our body. This is where biologic dentists are more focused about the long-term response, healing of their patients. And not only, okay, we put this and you're done, now you're functional. You might be functional, but where are they gonna be the long-term effect of this type of restoration overall in your body? A lot of dentists, and I have this conversation because I go to a lot of dental conventions, although I'm more driven to go to medical conventions. They debate with me, oh, the mercury amount is so small. Why do you worry about that? They're more durable. I mean, I have the responsibility with my patients to whatever I put in their mouth to make them feel better,
Yeah.
healthier.
And there's a lot showing that the amount that's released is not a trivial amount biologically
But
in
it's
terms
still
of like
more
what goes
than
to our body.
mercury that you would ingest from
seafood,
Yeah,
which is the
from
second
eating
source.
big fishes.
Yeah, the two biggest sources are mercury in our mouth. That's number one by far. And number two is seafood. So we have people that are aware of the seafood component, but unaware of the source in their mouth. And we're going to give you guys the opportunity to ask Dr. Yani some questions. So what you can do is, if you have questions for Dr. Yani, if you're in the South Florida area, check out her practice. It's in Fort Lauderdale. I trust them with my with my mouth.
You have a boring
and my dad as well. And what we'll do is Dr. Yani will check in on this video, and if you guys have questions, put them in the comment section, and she'll do her best to check in and respond. And then also, we want to show them some pictures of what was in my dad's mouth.
Oh yeah, absolutely.
This is not for the faint of heart,
Oh,
but
gosh.
it is something that that you guys want to be aware of. So, and while Dr. Yani pulls these up, like here's some questions that you guys may want to ask yourselves. If you guys are getting value from this video, click the share button, tag people that you love and care about that may have mercury in their mouth or maybe dealing with chronic fatigue, fertility problems, and some of the other things that we've discussed, so that we can bring this issue to light and let more people know about it. But if you have silver and mercury fillings, gold fillings, root canals, implants, tooth pain, bleeding gums, gingivitis, problems with chewing, or even if you've ever had a cavity, there is a chance that you may be dealing with not just toxicity from mercury, but also dental cavitations, abscesses, and gram-negative bacteria in your mouth that can also wreak havoc on us biologically. And it's not something to be afraid of, but it is something you want to take action on. So Dr. Yani is going to show you guys. Yeah, let's hold it up to there and see if they can see what was in my dad's mouth, or at least like.
Is it good?
You guys able to see it?
Yeah, that was the pre-op photos. And when we do mercury removal, we put rubber dam, we seal off. We don't want to expose removing mercury. In this case, he had gold crowns, but we suspected there might be mercury underneath because prior restorations that we removed, it showed the presence of mercury underneath in decay. So, and the problem is what I discussed, the oral galvanism or production of current that affect negatively the response of the gum tissue. These are some of the restorations that we did with a certain machine done in one appointment. We put porcelain, which is primarily lithium disilicate glass, which is very biocompatible with tissue and easy to clean. But I just want to show you, this is some of the mercury underneath of what we remove on him.
And guys, like if you think about it, so we know mercury crosses the blood-brain barrier. So now it's in a part of your body that can contribute to neurological, neurodegenerative disorders like Alzheimer's and Parkinson's and dementia. We also know that it crosses the cellular membrane. So it's getting into, almost went over backwards. But it also can get into the cells and affect your mitochondria, which is what's responsible for making energy in the body. And a lot of aging is just simply related to how well your body makes energy. So now you have something that's a toxin, decreasing your body's energy production, and even where it's not doing that, your body now has to allocate more resources, more electrons, we're talking about electron loss, to neutralize the free radicals and reactive oxygen species being produced by the mercury. Net result, you're tired. Right? So even if it's something as simple as being tired or dealing with stubborn body fat, it can all be related. And if you guys feel like you may be dealing with this or you have someone that is, click the share button, let us know that you guys like this video, reach out to Dr.Yani in the comment section. She'll do her best to check in and help with your questions, and let us know what else you guys are interested in, and we'll do our best to help you out and make sure that you guys are feeling amazing. And yeah, if you're in SoFlo, come see these guys. They're awesome. They have my biohacker seal of approval, and you will love them. So thanks, guys.
Awesome. Bye, guys.
Bye.